it's estimated that a patient with a patient with epilepsy, with a new onset epilepsy, takes around 10 to 15 years to be diagnosed with medically refractory seizures. So it takes a long time, depends in a number of issues, but for the patient to be recognized as not responding to the current type of medications we have available to control seizures. And this may lead to a number of years, a decade of trials and a lot of side effects of the drugs, and having seizures repeatedly, which may represent a risk for the patient. We know that patients who are not controlled, whose seizures are not controlled, they are at risk of earlier death, SUDEP. Also, because of the side effects of the anti-seizure medication and because of the ongoing seizures, the patient may not be able to go to school or to work. So there is a number of issues related with the quality of life. So if you can have an earlier diagnosis that the patient is refractory or is likely to be refractory to the current anti-seizure medication, you can propose other treatments, such as epilepsy surgery, such as ketogenic diet, or even other types of treatments, such as nervous vagal stimulation. But the problem is that we don't have good biomarkers for that. Usually you have to wait for a long time to be able to confirm that the patient is refractory. And with this, you may lose precious years in terms of quality of life for adults. And if we're talking about children, it might mean that the child will be able to have a normal school, go to university, and so on and so forth. And if not, if you still have seizures, it might mean that this child will have a very delayed education and may not be able to catch up even after you find a good treatment, alternative treatment such as surgery and so on and so forth. So as early as you detect that the patient is going to be refractory to the current medication is best. Then you can try to do something else. There are a few circulating molecules that are being investigated. It's still research, but there have been some candidates, such as noncoding RNAs, micro-RNAs. There has been also some metabolites that might be good candidates. I think that the bottom line is that it's very unlikely that you'll find only one molecule that will make the big difference and that you'll be able to separate the groups that are refractory and not. So I'm a strong believer of finding multiple biomarkers that when they are used together, you'll get a better answer to the question whether the patient is going to be refractory or not. So I think that's the future, to have multiple biomarkers of refractory seizures. So let's hope we can start clinical trials with these biomarkers. I mean, so far we have only preclinical studies, observational studies with small number of patients. But the ideal would be to do a prospective study using a methodology similar to clinical trials to see whether these biomarkers perform well in clinical practice.